Hey guys, Dr. Garza from One Spine Chiropractic. Today we're going to talk about one of the more common presentations that we see in office, and that's going to be headaches. Now this can be tension headaches, migraines, cervicogenic headaches, or even sinus headaches. If this is your first time in our office, we're going to begin with a consultation and a detailed exam to make sure that you're the right candidate for chiropractic care. Once we begin our exam, we're trying to isolate where the root cause of your headache is. Now, 9 times out of 10, your headaches are stemming from your neck, aka your cervical spine. But we need to help figure out which segments of the neck are causing these issues. Now, usually these issues are caused by what's called a subluxation. It's whenever 2 or more vertebrae or bones of your neck are stuck to each other and they're not able to move properly. When this happens, it'll cause increased inflammation, irritation to the nerves in that area, increased symptoms or pain levels, and it'll also decrease the range of motion or the movement in that area. Now, going over the anatomy of the neck here, with the neck or cervical spine, we have 7 bones or 7 vertebrae that help support the weight of your skull. Usually for headaches, the trouble area is going to be C1 and C2, the first 2 vertebrae of your neck. These are closest to the brainstem, and there's a lot of nerves that exit out of this area that run through the top of your head, to the side, your jaw, your ear, and can also cause tension at the base of your skull. Now, my job as a chiropractor is to go through the cervical spine, feel what joints are subluxated or aren't moving properly. That way they can be addressed. Because if a vertebrae is stuck in one position, it's going to cause that irritation on those nerves in that area, creating the symptoms that brought you in here in the first place. Now, on top of the adjustments here at One Spine Chiropractic, we also offer dry needling, because with the subluxation also comes tight muscles. The best case for these tight muscles, the best treatment, is going to be some type of soft tissue modality, whether that's going to be our TENS unit or my personal favorite, which is dry needling. As you can see here at the base of the skull, we have muscles that connect from the base of the skull to the top part of your cervical spine. They're called your suboccipital muscles. Now, those muscles can be tricky to get to, but luckily with dry needling, we can be specific with the trigger points in that area to help alleviate that muscle tension on top of our chiropractic adjustments. Now, if this sounds like something you've been dealing with headaches and a recurring issue, or you know someone that has, please reach out to our office. That way we can get you booked and make sure we get to the root cause of your problems.